Okay, so today I'm doing a new patient exam day, and this is Robert. Robert is 14, and his mum has brought him in for a second opinion, effectively, regarding extraction of teeth. Now, a couple of things I want dentists and the public to learn is that when a child is a mouth breather, the palate is not formed properly, and that's what's happened with Robert. If we have a look, can you open Robert? If we look at his upper jaw, you can see how narrow it is, and you can see how there's no room for his teeth, okay? If we look at the lower jaw, you can almost see like a double layer of teeth, and look at all the back teeth rolling in. So for me as an orthodontist, it's much harder now to do palatal expansion because most of the growth of the jaw is complete. And that makes the treatment more complicated and difficult. So we can still treat non-extraction, and we'd have to do that using lighter forces. But the point I'd like to reiterate is that if your child has nasal obstruction problems, the best age to bring them in is while the palate is growing. So the American Orthodontic Association, for instance, has a great website where they say the best age for an orthodontic consultation is age 7, and one of the reasons is related to the ability to get in and change the jaw structure. And I've just talked to mum. Robert's mum has confirmed that he's had nasal problems all his life, and yet the dentist has just been watching and waiting. And my question is, well, watching and waiting for what? I mean, those teeth aren't going to align themselves. So the take-home message is, if you have a child between 7 and 9 who has airway obstruction, that's their best age to do the orthopedics. So you don't then end up with this. So when I trained in orthodontics 30 years ago, the way I was taught to do my treatment, you waited till the adult teeth came through, so of this age, the orthodontic age of 14, and then you'd pull out 2 teeth here and you'd pull out 2 teeth here. Now the problem with taking teeth out, the palate's going to get narrow, which is going to further affect the breathing. So you're compounding the problem, not to mention changes in the facial profile, etc. So to me, I'm a big advocate that we want to get in early and get that done. And I know, Mum, you were saying that you've had teeth out in the past, is that right? Yeah.
So basically wait for the adult teeth to go through, yeah, and then to just remove the teeth.
Yeah. And your son,
get the braces.
And your son has had nasal problems for how long?
Yes, that's right.
Yeah.
Most of his life.
So one thing that I've done is I put a brochure together. I'll take my gloves off so we can show you that, which I'm happy to send to any parent or any dentist. This is a brochure that explains the influence of nasal airway on facial development and what timing we want to do that treatment. So again, in here we're displaying what is a narrow palate and how we'd want to widen that. Secondly, we're talking about the major causes of this, and this brochure has great references on the back for parents to look at, and also for doctors and dentists to read, so everyone gets the picture that the best age for orthodontic interception is not age 14 when the damage is already done.